everyone. I'm glad to see you. And this is a really great number on the call. So thanks, everyone. And just a real quick housekeeping too. Rebecca mentioned earlier we were having some internet issues. So just by chance, if that happens, just be patient. We'll get everybody back on the same page. I am excited about sharing with so many of you, talking about a little what we're having happened at the State House, and we're going to talk about some local issues. And then we really want this to be a learning experience for us. So what's going on in your communities? What do you have? What questions do you have? What can we do to help you? So as Rebecca mentioned, I'm the Government Relations Director for ACS CAN, the American Cancer Society Cancer Action Network, super long name. I partner with the American Heart Association, the American Lung Association, ANR, TFK. I think I saw Megan join a little earlier. So we are kind of the national tobacco partners, and we partner on a lot of this work together. And so you are just stuck with me today, as my other colleagues have other things kind of happening and going on. But I am excited to share. And I do think we have a lot happening, a lot going on. So I'm going to jump in and talk a little bit about what to expect with the state session. So our state session started, this week? This has been a really long week, guys, a really long week. It started on Tuesday, and we were kind of off to this booming, crazy start. So you'll see there on the screen a lot of things right now to consider with our state session. We have, close to, you probably have heard this, you've seen this. Oops, sorry about that. We've had close to $10 billion to spend, and that's a combination of excess funding from our state budget, from federal dollars, from Savannah Riverside funds, a deal that finally kind of has come to the end with the federal government and our state. We have a lot of money right now for our state legislators to spend, and all of that money is popping up in an election year. An election year for everyone in the House, for the governor, and for all statewide offices like our state superintendent of education, very important office. So it's going to be kind of a crazy year, crazier than normal in a lot of ways, because we do have this huge pot of money. And when that happens, then in election year, then we have lots of people vying for that money, and we have lots of personality that comes out. So it's just going to be really interesting to see how all that works. Now we throw into that, we have new leadership in the Senate. You may have seen that the previous Senate Finance Chair, Senator Hugh Leatherman from Florence, passed around the holidays. And so we have new Senate leadership. Some would have said that Senator Leatherman was the most powerful man in South Carolina because he controlled the purse strings of our state. So now the new Senate Finance Chair is Harvey Peeler out of Gaffney. He jokingly says he speaks Gaffnese. I'm not sure if anyone on the call is from Gaffney. I have no idea what that is, but that's what he says. So Senator Peeler is the new controller of all the money. We have new leadership, a good friend of ACS CAN, and really a good friend to tobacco control issues, and that's Senator Alexander from Oconee County, from the little town of Walhalla. He is the new president of the Senate. And so that could be good for us with our public health issues, or it could be harder, as now he is in a leadership position, and oftentimes leadership positions at that level will sometimes take a step back. So we'll have to kind of see how that shakes out for us. We're going to be facing a lot of public health issues, and I see some of our friends from DHEC on this call. You know, goodness, I'm sorry, and I just feel for y'all and all that you're going through. All of our public health workers right now, our doctors, our nurses, anyone in public health, thank you. It's crazy times out there, and I cannot imagine, and so thank you. I listened to a debate this week on the moral and ethical conscience of mandate. I'm trying to get this right, of mandating vaccines or masks in schools. So, I mean, we are dealing with lots and lots of public health issues on all the different levels. I mean, how do you debate moral and ethical conscience. That's really, really hard. So we're dealing with these public health issues. We're dealing with vaccine and mask mandates. We're dealing with education reforms and public school vouchers, all at the same time that we're losing our state Department of Health, public, someone help me out here, education person, Molly Spearman. So it's going to be crazy. We're looking at certificate of needs, and we know this impacts our rural health communities and how patients in South Carolina, which we're like, what, 80% of South Carolina is considered rural. So we're looking at certificate of need and how it impacts rural health. We're looking at tax reform. There's even the possibility of taxing drugs. That would be crazy, but it's out there. It's on the table. So a lot of things happening to make this session, I think, the second year of a 2-year session, to make it an exciting and crazy one. And so we're looking forward to all these things happening. So in the middle of all of that, we have 3 tobacco bills that are also out there on the table. And that's what I really wanted to talk about at the state level. So we have this bill 3681, tobacco preemption. All right, here's a pop quiz. Megan, help me out. If you guys can raise your hand, okay, we're going to do a pop quiz. Raise your hand, the first person who wants to tell me what preemption means. Any hands? Yep, that's what I thought. Any hands? Come on, Phil. Sharon.
Oh, gotta unmute.
Yes.
You'll probably say it a lot more eloquently than I will, but in essence, it preempts local action on certain topics. And in the case of this particular bill, it limits action on flavor products and things that are related to point of sale issues, which we know drive youth use.
Yay, Sharon. Very good. Thank you. You know, we have this big fancy word called preemption, and it confuses folks. It throws us off. It's a little bit hard to explain to the general public. So tobacco preemption, the House Bill's 3681, it does what Sharon says. Preemption basically restricts local use. So there's a lot of things at the state level, local level, that are preempted. Right now, we don't have any preemption on tobacco flavors or tobacco retail license. And so what this bill means is that the state is trying to take away local control. Easy, simple put. State's trying to take away local control. Right now, local communities have the ability to create local ordinances to prevent flavored tobacco products, menthol included in that. They also have the ability to create an ordinance that would require tobacco retailers, anyone who's selling tobacco products, to register, to require a license to sell the product. Much like we have a license to sell alcohol, there is no license across the state in South Carolina to sell tobacco. So, you know, I'm looking at my yard out here. I use this analogy all the time. I could go out to my front yard. I could put up one of my husband's Gamecock tents, and I could buy some tobacco products and sell them out of my front yard. And I don't have to have a license to do that. Nothing. Doesn't matter. I could just do that. I could sell it. I mean, you know, who's going to come along and check and see if I'm selling it to whoever? So this tobacco preemption bill is bad. We want it to be stopped. It's bad because it would prevent local control. So here's another pop quiz for you guys. Does South Carolina have a statewide smoke-free bill? No. Rebecca's shaking her head. No. Dr. Keeley?
No.
No, we do not. So, but we have communities covered under smoke-free laws, right? Yes. How have we been able to do that? Community by community, city by city. It's the local folks like Dr. Keeley, who is an amazing champion in Rock Hill. It's the local folks who have been able to work on local tobacco control. So going back to preemption, if the state says, locals, you don't have this control, what does that mean for our local communities? Because we don't have a statewide flavors bill. We don't have a statewide tobacco retail license bill at this point. So tobacco preemption is super important. And I know I've called on many of you last year to help us stop this bill. I'll just say really quickly that this bill was sponsored by the House Minority Leader, who is Todd Rutherford out of Columbia, and the House Majority Leader, who is Gary Simrell, Dr. Keeley's representative. Sorry, Dr. Keeley. Dr. Keeley's representative. And, these men, for whatever reason, thought this was super important. And so they pushed it out, and they had a subcommittee hearing on it. They had a committee hearing on it, and they voted on it on the House floor all within about 3 days, which is very unheard of. But what I like to think is that they were scared of us. And so they wanted to push it out fast because they knew we could stop it if we just had a little more time. So they pushed it out fast. They got it through the floor. It went over to the Senate. The Senate pulled some dirty tricks as well. And so it went to Senate Medical Affairs with Chairman Danny Burden from Lawrence. And he didn't even want to hear testimony on this bill. He didn't even want to hear from us. So he basically refused to hear from us. And what he did was what they do is they polled it out of the committee. They took a quick poll of the committee and they said, hey, how many of you guys would vote for this? Yeah. Okay, we're just going to push it right onto the floor. So they refused to hear from tobacco advocates. They pushed it right on out to the Senate floor. Thankfully, we have amazing champions who stopped the bill. We have 5 senators who have put their name on this bill to stop the bill. And those senators are Senator Sin from Charleston, Senator Hutto from Orangeburg, Senator McElveen from Sumter, Senator Keeley from Columbia, and Senator Kempson, also from Charleston. So those 5 senators put their name on it. They recognized that it was bad. It was bad. It's going to be bad for tobacco control, for public health. And they said, wait, we got to slow this train down. So what this means is that because they put their name on it, they slowed it down. Now there's several other procedural moves that have to happen in order for it to get placed back on the calendar to be voted on. It's not over yet, because if it does receive the votes to be voted on, it's going to pass. And so that's what we know. We know that the Senate would likely have the votes to pass it if this bill moves to the calendar, the normal calendar where they would just vote on bills every day. So we still need everyone's help to really, really talk to their senators. And I'm going to talk a little bit about how we do that. But we still need everyone's help to really focus on tobacco preemption bill. So tobacco retail license. And this we kind of mentioned in relationship to preemption, is that our state does not have a statewide tobacco retail license. Anyone can sell tobacco products regardless, wherever. We have no license. You have to have a license to sell them, like you would do alcohol. A few years ago, we were having a conversation with a tobacco lobbyist in the hallway on preemption, and we said, well, you know what? They want to compromise. Well, we don't compromise with tobacco companies, but they want to compromise. And so they said, let's compromise. And we said, okay, well, we'll do a statewide tobacco retail license. How would you like that? And of course, they don't like that. But this is kind of our response to the tobacco preemption bill that the tobacco industry introduced, is a tobacco retail license statewide. This becomes really tricky. There's a lot of detail in this this bill 3754. It has not moved. I don't think it will move, and that's okay. But it was a response to the tobacco preemption bill that was introduced. South Carolina does at some point need and want a tobacco retail license, but we're not quite ready for it. We have some other things to put in place. You guys may be familiar with PUP laws, and we need to clean up some of our other tobacco regulations and laws before we can get a clean tobacco retail license bill at the state level. But I want you guys to know that it's out there. I don't see it moving. The other bill that we have currently at the state level is the Tobacco 21 bill. True or false? The federal government passed a Tobacco 21 bill a few years ago. True, right? So what are we doing in South Carolina? Why All right, so we have this tobacco T21 bill, also introduced by Representative Todd Rutherford of Columbia, the same one who introduced tobacco preemption. And so Representative Rutherford said we need to create a law in South Carolina that you have to be 21 years or older to purchase tobacco products, although we already have the federal law. And it's unconstitutional. So South Carolina has this lovely clause in our Constitution that essentially says, in order to change the age of sale for any product and other than alcohol, it has to go through this constitutional amendment. We can't change that. In order to do that, we would have to change our state constitution, which is a process. That's not just a simple legislative vote or policy change. So why he introduced this, there are lots of reasons. I don't know. Representative Rutherford, just for fun, also introduced a bill this year to decrease the age of alcohol sales, which is currently 21, and he wants that to be 18. Sometimes I just shake my head, like, I don't know. But we're watching it, we're monitoring it, because if it does get traction, it really is a distraction. And that's what the tobacco companies want. They want to distract us. They are, let's give it to them. We know they're super smart. They're super savvy. They've been doing this for years. They have more money than I can even imagine. And so they want to distract from the real issues that we need to push us forward. National Tobacco Partners will tell you that the real issues to make any real difference and change in tobacco control, we call it the three-legged stool. You guys have heard me say this probably a million times, but it's tobacco control funding. We need to fund tobacco control. We need to pass strong smoke-free laws, and we need to pass a strong, high enough tax on tobacco products. And tobacco companies will do everything they can to prevent us from moving those three issues. All right, I'm going to move faster, try to. I'm going to talk a little bit about our tobacco local efforts here. I'm really excited about this, and good to see Phil Clark on the call with Just Say Something Greenville. I'm really excited about our smoke-free work. And, when we look at what we can do, when we look at what we can't do in South Carolina, that's super frustrating. We can't pass the tax right now. There's no way we can do that. We are trying our darndest to fight preemption, and I'm really, really hopeful. There are a lot of things we can't do, but what we can still do is work on local smoke-free efforts. And so that's really what, I see. I'd like to see more of our tobacco coalition partners doing this year. Let's focus on what we can do. We can do smoke-free locally. And so thinking about our population coverage, American for Non-Smokers Right, ACS CAN, we consider things a little differently in our state. We look at percentage of population covered comprehensively to include all restaurants, workplaces, and bars. And so we have about 32% of the population covered under a smoke-free comprehensive law. Now, I just want to note our definition is slightly different from DHEC's definition. There's nothing wrong with either one of them. It's just the way it is. We calculate data a little differently. The smoke-free laws in our state, the ones that have passed, are good. They're strong. Some need a little tweaking now because we passed them in 2005, 6, 7. They need a little cleaning up, and we can do that to make them stronger. And then we have really, really strong communities that are working on increasing our smoke-free coverage by passing a new law, a new ordinance. So, we have Phil would Just Say Something, who's championing a few of the communities in the upstate that we can push forward, and we can work on smoke-free laws with communities that don't have smoke-free coverage. And what we're hearing is that folks are like, well, I thought we already did that. Didn't we already do that? And so we're like, no, but we can help you. We can help you do it. So we're looking at some areas in the upstate. We're looking at cleaning up some of those Charleston ordinances that I'm not even sure what happened to them, but they all got messed up. And so the city of Charleston, the county of Charleston, I think it's Mount Pleasant. There's a few others that just need cleaning up so that ACS can, the national partners will count them as population covered with a comprehensive policy, and that will, of course, then increase our total population coverage. We're looking at some of the folks down in the Low Country in Horry County to see what can we do down there. We had some momentum, we lost some momentum. The mayor of Myrtle Beach is interested. She wants to talk. Now, take it that we're doing all this in the middle of a COVID surge, you know, like we're trying, but it is what we can do right now. So we're pushing forward, we're making incremental steps, and that's positive. Tobacco retail license at the local level, I want to just call out Dr. Keeley and that Rock Hill team. If we had like a model tobacco coalition, in my opinion, I would say it's Rock Hill. They are the model tobacco coalition. They just have it together in such a great way that they're able to push out things continuously. And so they are working on a local tobacco retail license, which is really, really exciting. They are not just working on it, but I mean, I think they're pretty long in the process, and I expect them to have a win. Like, I think they're doing a really great job. So local communities, again, we can work on local tobacco retail license right now. If that tobacco preemption bill, this H3681 passes, we're dead in the water. But for now, we can do it. And then finally, I wanted to point out some really cool things that's happening down in Charleston. And I think I saw Shayla Compton on here with the Center for Black Health and Equity. Shayla, thanks for joining us today. Really cool partner. Breathe Easy Tri-County. You know, this is a group that I will say just a small group of committed folks, really no tobacco background other than Shayla and some folks from the Center for Black Health and Equity, but passionate about their community and passionate about how the tobacco company has for years targeted the Black community and wanting to make a change. And I'm so excited about this. Now, flavor bans in South Carolina, are we ready for it? Probably not, to be very honest. But we're starting, we're having the conversation, we're gathering the troops, we're figuring out what we can do in an environment that's really hard. So I'm excited about working and helping the team down there on a flavor ban. And along with that flavor ban, we would have to put in a local tobacco retail license so we would know who's selling the flavored products. But I do think this is important for us, and I think there'll be a lot for us in the state to learn from this coalition as they continue to kind of build and get moving and decide how to do this and how do you talk to people about flavors and menthol within the Black community especially. So I'm excited with what they're doing and some of the work that they're even hopefully will be doing with the Black Caucus. So a lot of things happening locally. Lots of people ask all the time, okay, I am a state employee. What can I do? Like, I get what you're saying. I hear you, but I can't do anything. So I want to give you guys a couple of quick, easy definitions here. Advocacy, lobbying, and education. You guys read those. I'm going to take a sip of water. And I want to talk about those for just a second. So advocacy, as you can see, is simply support of, public support of a case, an issue, a policy. I support it. I advocate for it. I support it. Lobbying is you are attempting to influence an elected official. Written, verbally, even the intention of can be considered lobbying sometimes. And then education is simply processing, receiving the information, sharing the information, the instructions. And so all three of these put together is the work that I do, the work that many of you guys do. But I know there is concern because the lines blur. Even with these three definitions, the lines are blurred, right? What is lobbying? What is education? What is advocacy? So I want to be really clear that as state employees, and I know many of you guys are, as state employees, you can educate it is your job to educate, right? You're educators. You're going to educate our elected officials. You're going to educate the general public. And that could look like something like, Sharon, I'm going to use you guys as an example. I'm super excited about this youth tobacco survey results that will be out sometime this year, maybe in the spring. And there's a committee at the State House. It's a joint legislative citizen committee on children. We call them the Children's Committee. And they love to receive information on issues that impact our children and youth. A good example of what Sharon's team could do is to educate the Children's Committee on the survey results. So Dan, no pressure, but as soon as you can get that to us, we would appreciate it. You could educate on those results. Now, they're not going in and saying, here's what the results say, and so we need X, Y, and Z policy, regulation, legislation. That's my job. I can do that. I'm a registered lobbyist. But what Sharon can do, or what any of the other state employees can do, is present the data that you guys have. I'm going to be really, really frank here, and apologies if this is not true, but I feel like you guys have super good data and you're not sharing it enough with legislators. I'm just going to say it. I know you're doing the work in the field. I know that you're doing it because I hear about it, but our legislators are not hearing about it. So then when I go in and say, this is the problem we have, they're like, really? No one's come to me about that problem. So do you see where I need you? I need you to share what you're doing. And it could be something as small as, this is really not small, but it could be, you know what, down in Charleston, our coalition, we're hosting this event to educate parents on electronic cigarettes. Tell your legislators you're doing that, because then they're going to say, well, why are you doing this? I didn't think that was a problem. Is that a problem? Tell me more. You can do that all day long. It's education. I need for you to do that. You can share it on social media. You can send a picture to your legislator of your event, showing them what you did, showing them the people that were there, because that shows them their constituents are interested in this issue. We have to tell the story to our legislators. When we're not telling the story, the tobacco company is. And they're telling a very different story than what we know to be true. So I need you guys to educate, educate, educate. I need you to lobby too. And you can lobby on your own time. You can lobby without your credentials behind you for state departments. It's a very fine line. And what I would just say is ask your supervisor. And if they're not sure, ask me and I can help you with our state ethics department, and we can figure out if you want to do some of that work. But most importantly is educate folks. All right, I see, I'm going to stop there because I do see a hand raised. Sharon, maybe?
Hi, Beth. That was me. Is it okay to throw something in real quick?
I think so, yeah.
Awesome. So just so you'll know, so I'm the state surveillance coordinator. So I, even like further upstream from Dan, I get to run everything by his desk. And I apologize in advance because these comments were not run by his desk ahead of time. But no, I appreciate what you're saying. And I think it's a really real and valid critique that we don't interact with legislators as often as we may be able to. I think that there are definitely levels of bureaucracy there that are important, and checks and balances there for a reason.
Yeah.
The one thing I did just want to throw out, this is just something, I study information and specifically misinformation for a living. And if anyone right now Googles, I want to just double check so that it's true. If you Google CDC e-cigarettes, the very first thing comes up is the basic information landing page from the CDC. And the first sentence says, e-cigarettes have the potential to benefit adult smokers who are not pregnant if used as a complete substitute for regular cigarettes and other smoked tobacco. I wholeheartedly believe that. All the data I've seen is that e-cigarettes are very beneficial to those who smoke cigarettes. That's a statement, though, that a lot of people in public health struggle with, right? A lot of people, not just in our own organization, but in the US specifically, have this idea that nicotine is bad, right? Like nicotine in and of itself. And that's something that we could parse over time, but it is something that isn't really up for debate is the fact that e-cigarettes are, the data that we have right now are less harmful than combustible tobacco. And so I think that's another just added layer of complexity that makes it hard, right? We can't really go to legislators and say, hey, e-cigarettes are bad, full stop. Or at least I'm not comfortable saying that because I haven't seen data that says that. I hope that makes sense. And again, you know, we're funded by the CDC. I like being, you know, having a job and having a roof over my family's head. So I'm not going to go out and say anything that's against what the CDC's point is. That said, the CDC has that as their headline because people need to know that this is a difficult topic, right? And so if we were to just say, hey, ban all e-cigarettes, we would be hurting the people that could switch to a safer alternative. So that's the one thing that I will say is just like, man, it's difficult, you know, this whole idea of lobbying and education, especially because misinformation, the reason it's so difficult to get rid of is because it's visceral, right? It's emotion driven, not logic driven. Anyway, even though emotions can be logical, that's all I wanted to say. I hope that wasn't too much, but thank you. I've loved the presentation thus far, so thank you so much.
Yeah, Jaron, thanks for that comment. I think the issue of e-cigarettes is very complicated, and the argument of harm reduction is very complicated, and there are many, many different sides to that. For this presentation today, I am not getting in the weeds on that. I don't want to touch that right now. I'm not getting in the weeds on that. What I do want to say to your point is that we have to be able to give, like you said, Jared, very clear information. We have to support what we say with data and with science. At the same time, note that when we're talking with legislators, sometimes we have to massage that, not untruthfully, we have to massage how we present the data and the science, not to in any way construe it or make it not accurate, but we do sometimes have to change how they not even interpret it. That's not even the right word either. How they see it, and then let them interpret it for themselves. So good points. I am not touching harm reduction and e-cigarettes today. The national partners have very clear guidelines on kind of what we think, and I think lots of other folks are kind of still working through that. Yeah, and I think Megan probably has one more. Yeah.
Sorry, my camera's being a little wonky. But just using that as an example, you know, I understand that folks who are working at some of the agencies want to be very mindful about how information is presented, you know, and being perfectly accurate. I think looking at the CDC information on e-cigarettes, using that as an example, you know, Beth is talking about, you know, T21 and preemption of, you know, or making sure that we have continue to have local control on flavors. I mean, one of the things that the CDC does say is that e-cigarettes are not safe for youth and young adults. Full stop.
Yeah. Right.
So that information is also right there. So when we're talking about how we present information, it's making sure that we're highlighting key aspects of the data that we do have to call their attention, because a lot of people won't even look at the second bullet of any particular fact sheet. But as you know, as folks who work with agencies, you know, we can say clearly across the board, e-cigarettes and cigarettes, they're not safe for youth, they're not safe for young adults, they're not safe for pregnant women. And honestly, with a lot of the things that we're putting forward, even with flavor bans, like I agree with Beth, we're probably not quite there yet in South Carolina, but in other states, we're talking about banning flavored e-cigarettes and cigarettes, not banning all e-cigarettes. So even in places that have put flavor prohibitions on sales, we've not eliminated e-cigarettes altogether. So a lot of what we're doing is also calling attention to folks to say, what something is and is not. No place has actually banned e-cigarettes altogether, just flavored e-cigarettes. And for folks who have a position of authority and due to the information that you have access to, that's where your voice can be incredibly strong in some of these conversations.
Yeah.
So
Thank you,
that's
Megan. I'm sorry, Megan. Thank you. That was a good comment. And Megan, I think you kind of reiterated what I was trying to say, not so eloquently, about massaging the data. We don't massage the data and changing it, but again, it's the presentation sometimes in that, if we give a legislator a one-pager, we are going to be really, really fortunate if they read the first 2, 3 bullets, maybe. Anything above the fold, we're going to be really happy if they read that, because they're busy. They have lots of things going on, so it's not that they don't care, maybe they don't want to, but they're busy. And so again, it's all about how we present things to them. So both very, very good points. And the harm reduction e-cigarette argument, goodness, at some point, maybe in the future, we'll have more clear data, but it is, it's a lot for everyone to take in and to understand. So I want to, I thought I had one more slide here. And let me see if I do. Okay. Be an advocate, be a champion. Again, just your voice matters, your story matters. Every single person on this call has a story as to why you're working in tobacco control. And someone needs to hear that story. It could be, personal, or it could be you just want to, look out for your grandchildren in the future. You have a story. And so how do you share that story? You can share that story. That's education. You can share that story. That's your personal story. It could be your organization story, your company's story. How do you share that story? Local letters to the editor, email your senator. Don't be afraid of them. I say this and this sounds really, I'm not sure how this sounds. To me, it sounds it makes me laugh every time. But, my mom would always say they put their pants on just like we do, one leg at a time. So, don't be afraid of them. Reach out to them. Introduce yourself. Quite frankly, you guys on this call, you are the experts in tobacco control. They are not. So they need to hear from you, the expert, to introduce yourself to them, to say, hey, this is what I do. I just want to let you know I'm here as a resource. If you're hearing questions from someone, come to me. I can tell you the facts. I can tell you the truth. I can tell you the data. Send them a photo, send them a note, send the data, send the activities, send the events, let them know about it. Use social media. Legislators love Twitter. They love Twitter. I don't know what it is, but they love Twitter. Not so much Facebook, not so much Instagram. I don't even know the other ones myself, but they love Twitter, especially during session, and they tweet all the time. And sometimes they probably shouldn't be tweeting, but they do it. And so, respond to them, like their comments, tag them, all those things that we can do using social media. It does make an impact, and it does really get your name, your organization on their radar. So if they have that question, we do not want them going to the tobacco lobbyist asking these questions, because I can guarantee you the tobacco lobbyists are walking the halls up and down every single day. And we do not want them to run into the tobacco lobbyist and say, hey, I got this question, let me ask you. No, that's bad news for us. We want to be their expert. We want to be their point person. What do you do? How do you find your state legislator? The website is on the screen, scstatehouse.gov. Type in your address. It'll tell you your federal all the way down to your local elected officials. You may say, I don't need to know them. I don't care to know them. You know what? Just look at their names. You may run into them at the grocery store, the ball field, wherever, where you could just say, hey, thanks for your service. That's all you have to do. Even if you're not like the same team as them, you can still say, hey, thanks for your service. So that they're going to say, oh, you're welcome. And you're establishing that relationship. I didn't know our monthly roundtable was called, Rebecca. So number 2 on here says, join our new monthly roundtable meeting. I think we have another official name for it, but that's what I'm calling it right now, which is coming up the 4th Friday of every month. So, and Sharon Biggers from DHEC is hosting our first one. So excited to that. And commit to one way to share your story within the next month. It can be really easy, really simple, but commit to one way to share your story. How many of you have friends or family members that say, what is it that you do again? Anybody? Yeah. Yeah. My sister, I've been doing this for 16 years. My sister asks me all the time, what is it that you do again exactly? Do you work from home all day and you get to like do laundry? And, I'm like, no, that's not the way it works. That's not the way it works. So share, even if it's just with your family and friends. What do you do so that we can spread this awesome work that everyone is doing, and that we can make a difference in all those little ways that add up to really big ways. So I just talked a long time. I'm going to stop, turn it over to Rebecca, see if you guys have any questions.
Like I said in my intro, I always learn from Beth. I mean, every single time I talk to her, I'm around her, I learn from her. So we do have about 10, 12 more minutes. If anybody wants to throw question in the chat box or unmute yourself and do a question, and ask a question, make a comment, anything you want. Meanwhile, I'm throwing up our cute little handy dandy graphic about our new, Beth, you had it, you had the name. It's just the South Carolina Tobacco Partners Monthly Roundtable. So there you go. Megan Austin put the registration in the chat box. So if you go look in the chat box, if you haven't already registered, I really encourage you to, particularly if you're interested in hearing what's going on legislatively, because Beth is going to give us a brief update at each of those on the 4th Fridays. So pencil it in your calendar, and each month we'll let you know who's coming up the following month. So I'm just going to be a little promotional and leave that on the screen. Anybody have questions? Raise your hand, unmute yourself, help yourself, go for it.
Yeah, this is Dave Keeley. Beth, with redistricting, it's probably good for you to add that people should recheck who their representative and senator currently is. Do you know whether that has been updated, on that web link you gave?
Yeah, that's a good point, Dr. Keeley. So another issue that the General Assembly is dealing with is redistricting, and that redistricting is not really going to take effect until after the elections of this year. So we'll have folks from filing for election. I think filing deadline is, I had it on a sticky note. Filing deadline is soon, maybe like in the next month or two. Oh, here we go. Filing deadline is March 30th. And then we'll have primaries in June with general elections in November. So by the end of this year, you will likely be in a new district.
Okay.
Yeah.
That's good to know. Okay. So that that's not in play right now. They still should use that web link and can go with whatever comes up.
That is right. And there's a federal court case challenging the redistricting bill that was passed in the House anyway. So it could be a little while.
All right.
Comments, questions, anybody? Chat box, raise your hand, unmute yourself, go for it. All right, well, then I'm going to thank Beth. Beth, do you have any closing comments before we shut down?
I just think we have such a great resource of volunteers and advocates in our state. And, I would just say again that I don't think we're sharing our stories enough. I think we've got to do that because I know you're doing the good work, but not everyone knows that. So please, please share your stories. Let people know what you're doing.
Okay.
Thanks, Jared. Off to share your story. Good.
Yeah. Beth, thank you so much. As always, we appreciate it. Beth will be on monthly, 4th Fridays, 10 o'clock. You'll get the update from her. And we look forward to seeing y'all again. You can email us at smokefreesc, or, let us know if you have any questions, or we can support any of the work y'all are doing, or connect you with anybody that's on here that you'd like to be connected with. Just let us know.
Yeah. Thanks for hosting, Rebecca.